I'm Conor Fitzpatrick. I'm a consultant radiographer in palliative radiotherapy at the Clatterbridge Cancer Centre in Liverpool. Palliative radiotherapy is the treatment with radiation of those patients that have secondary or metastatic cancer that is treatable but not curable. We often use palliative radiotherapy in the context of treatment and management of symptoms such as pain, management of bleeding, other disease involvement within organs like the lungs or potentially in the brain. And what it can be used, it's really useful particularly for management of pain for those patients that have secondaries or metastasis within the bones. At Clatterbridge Cancer Centre in Liverpool, we have what we call the Palliative Radiotherapy Service. It's something I'm incredibly proud of to be involved in. It is consultant radiographer led, so there are a number of consultant radiographers around the country that are developing similar services, and it's been present now and running for around 6 years. In essence, what we do is see, consent, examine, prescribe the radiotherapy and any additional scans that are required for patients that we see within the clinic. So it's a bit of a one-stop shop, all with the aim of trying to reduce the number of appointments that a patient has within the hospital, limiting their back and forth and ensuring that we've got that continuity of information that they're always provided kind of within the service. It is basically all about communication. If we can improve communication in any way, that is what we really want to do within our trust at Clatterbridge, but also widely within the NHS. I think information is always power, and if we can inform our patients as well as possible about expectations and also about what we can and unfortunately what we can't do sometimes, particularly in the context of palliative disease, that's really important and really hopefully empowering. I think the thing that makes me most proud about being part of the palliative radiotherapy service is the connections that we've been able to make, not just within our radiotherapy team, but wider across the local area in Cheshire and Merseyside. That includes within connections between hospitals, our nursing, allied health professionals like physiotherapy, the other specialists that help so much, including those within hospices, within enhanced supportive care, in order to provide that holistic approach and management of not just symptoms, but actually the whole person. We can sometimes a little bit forget that cancer is just one part of someone's cancer experience, but there's a whole person behind that. And actually, if we can make sure that we're keeping all of that in mind at all times, I think that we're doing a good job.